Mr. Sabhan, very dear patient of mine, came from Iraq. Unfortunately, he was having infection in the spine known as spondylodiscitis at L4, L5, for which he was operated also in Iraq, but the surgery could not be successful. Actually, Mr. Sabhan came to us from Iraq by airport. From the airport, he had to be lifted by ambulance to the hospital. He could not even sit or walk. He was bedridden for the last 8 months. So what was the problem was that the infection had eroded the L4, L5 disc as well as it had destroyed the bone. So we needed to stabilize the spine. So we did surgery on him where we stabilized the spine by putting screws and rods from L3 to S1, and also we removed the infectious tissue from L4, L5 and replaced that with a cage to give stability so the spinal column becomes stable. The removed material was sent for tests and it showed that there is infection, and now he was started on that specific antibiotics which came in the test that these antibiotics are acting against the organism which is causing infection in Mr. Sabhan. And here he is in front of you, he is walking comfortably, he is totally pain free within 2 weeks of surgery. Now through this video, the message that I want to give is that there is a myth that whenever there is infection in the spine that we cannot put screws and rods. Actually now we have realized that if there is infection and if it is causing instability in the spine, that can cause severe pain, disability and weakness in the legs. If actually we stabilize the spine by putting screws and rods and give column support, the infection control is much better, the recovery is much faster, the pain relief is much better, and also it prevents any kind of neurological deficits.